Today, we will be highlighting a new prostate cancer screening test, which is helping predict a patient's risk of prostate cancer with 94% accuracy using a simple blood test, empowering urologists to determine who should proceed with a biopsy versus continued monitoring. So stick around. So the big question is this: how can men and those who care for them better educate themselves regarding prostate health, the conditions that affect the prostate, and the latest technology in managing these conditions? That is the question, and this podcast will provide the answers. On the podcast, we'll be chatting with experts, innovators, and leaders in the field of urology, sharing useful information with the general public to improve their lives and increase their overall health. My name is Dr. Garrett Pullman, and welcome to the Prostate Health Podcast. The Prostate Health Podcast is for informational purposes only. Nothing in this podcast should be construed as medical advice. By listening to the podcast, no physician-patient relationship has been formed. For more information and counseling, you must contact your personal physician or urologist with questions about your unique situation. I'm very excited to partner with Oxford Biodynamics for our episode today with Dr. Robert Heaton. Dr. Heaton is a board-certified pathologist who completed medical school at Georgetown University and then spent 20 years in the U.S. Navy. He transitioned from completing his residency training in pathology to becoming directors of laboratory and clinical support services for the National Naval Medical Center, followed by several hospital pathology labs and life sciences companies. Dr. Heaton is the laboratory medical director for Oxford Biodynamics at their CLIA-certified clinical lab in Maryland, overseeing clinical operations of their liquid biopsy blood tests. Today's episode focuses on the new EpiSwitch prostate screening test, known as the PSE, for confirming the presence of prostate cancer in the presence or absence of symptoms. Dr. Heaton, welcome to the Prostate Health Podcast.
Happy to be here.
Prostate cancer is the second most common cancer among men in the United States after skin cancer. Now, a man is diagnosed with prostate cancer every 2 minutes. Some notable men who have been diagnosed with prostate cancer include Warren Buffett, Ben Stiller, Robert De Niro, Ian McKellen, golf legend Arnold Palmer, Al Roker, and baseball star Ken Griffey Sr. 1 in 8 men will be diagnosed with prostate cancer during their lifetime. With early detection, we are saving lives. Detecting prostate cancer at an early stage offers the best hope, with the 5-year survival rate at nearly 100%. Now, that drops to 28% if it spreads to other parts of the body, which is why prostate cancer screening and early detection is so important. The challenge is that there are usually not any early warning signs for prostate cancer. Dr. Heaton, I know many of our listeners would like to know at what age should they start getting checked for prostate cancer, and what does the screening typically entail?
Well, the screening typically entails a visit with a primary care provider, because that's usually where this happens. And the traditional screening test is the prostate-specific antigen test, or PSA. And the PSA by itself provides us useful information, but it's not the end-all and be-all of cancer disease. Along with the PSA, primary care provider could do a digital rectal examination. And so an abnormal prostate digital exam combined with an abnormal prostate-specific antigen test is compelling evidence that there may be cancer present. But many men have an abnormal PSA that turns out to be due to other causes. So consequently, it's useful to establish a baseline so that one can monitor the way PSA changes over time. Men, generally speaking, should be screened, get that baseline started in their middle 50s, maybe plus minus a year or two, unless there are some kind of factor which increases the risk for an individual patient. And those things include a primary family member that developed prostate cancer at a young age. My father got prostate cancer in his 40s. Well, maybe I should start getting my baseline in my even 30s at that point. My brother got it, so maybe I should get started, that sort of thing. Also, other malignancies in your family predispose one to the development of cancer. And in those instances, getting started in your 40s is probably a better idea. But again, this happens in conversation with your primary care provider. And evaluation of the prostate-specific antigen test has been fraught with difficulty over time. There have been various ways of interpreting it and levels and cutoffs and whatnot. But really, it's a very good marker for the presence of something wrong in your prostate. Not necessarily cancer, but something wrong in your prostate. If your PSA is negative, and your digital rectal exam is negative, then probably you're in pretty good shape, and we can continue to screen, monitor over time.
Well, thanks for reviewing that with our patients, especially in terms of thinking about what age to start thinking about getting checked based on your risk. What does that entail with the PSA, the rectal exam? And I know that I get a lot of questions about what level do you use for that PSA level to kind of get them in the door, so to speak. And I think the National Comprehensive Cancer Network, or NCCN, has some really good guidelines that state differing levels of PSA in terms of their recommendations. And one of which is if their PSA is less than 1 and the digital rectal exam is normal, then that PSA testing could even be extended out 2 to 4 year intervals. Now, if they're in that 1 to 3 range, that testing can be extended out to 1 to 2 year intervals. And then when that PSA is above 3, that's when the NCCN guidelines mentioned start talking to patients about options, including observation, prostate biopsy, as well as some additional options, including prostate cancer markers, which we'll get into here shortly, as well as consideration of a prostate MRI. But you had mentioned the limitations of the PSA. And when I'm counseling patients, I often discuss how the PSA is still a good initial check engine light for men and their prostate, but it's not a perfect test. While specific to the prostate, many things can cause an elevation in PSA, including just benign enlargement or BPH, infection, inflammation, but also prostate cancer. And in the past, that's all we had. But now we have better testing, such as prostate cancer biomarkers, and to help give men more information to help them in deciding if they should proceed with a prostate biopsy versus just continue to observe, check another PSA in a year. So I was definitely excited to hear about a new prostate cancer marker, the EpiSwitch PSE test, which just became available in the United States and the UK in September of this year, which coincidentally was also Prostate Cancer Awareness Month. Dr. Heaton, I know there was significant media interest following the publication of data from a clinical study showing the potential of EpiSwitch PSE as an accurate and rapid screening diagnostic. Can you get our listeners up to speed on what we really need to know about the EpiSwitch PSE test?
Sure. The EpiSwitch PSE test is a blood test. So you don't need any special preparation. It's not invasive. You go get your blood drawn, send it to the lab. And what we do is we look at the genetic content of the lymphocytes in the blood to see if there are signals in the immune system that prostate cancer has developed. It took us a long time to come up with this particular panel, and the science behind it is kind of complex. But the result is that it's a binary test. So the result of this is if it comes back at high probability of cancer, then the vast majority of patients in that category are going to have cancer in their prostate. And probably equally as significant, if it comes back low probability, then those patients do not have cancer, to the order of in the 90% range, which, if to your point of do I get a biopsy, maybe if the PSE comes back negative, that gives you a little bit more confidence to wait. If the PSE comes back positive, you probably really ought to go through the next steps that will ultimately end up in a biopsy.
Well, I know urologists and their patients will be happy to now have access to the EpiSwitch PSE, giving them more information, as you mentioned, as they navigate options with an elevated PSA. Now, what can our listeners expect in terms of how to go about getting access to the test?
Well, right now the access is done by the provider that is ordering the test. If there is a primary care manager who's interested for whatever reason in chasing this, then they can contact us, and I'll tell you how to do that in a minute. Or the urologist that says, yes, this fits into our workup and we need to get it. Then the doctor's office can contact Oxford Biodynamics and order a kit, which essentially is just a tube. And we send it to you in the mail with a box, and you get your blood drawn into it, and they send it back to us, and we do the testing and then report back to the ordering physician. You can Google EpiSwitch PSE and all this information will come up, but an easier way to go about it is we have the domain 94%. So all one needs to do is type into the browser line 94%.com, and it'll take us right to the PSE site. And the PSE site then has links to how to actually order tests and how to get the kits so that we can get these patients tested.
And what can a urologist and patients expect in terms of turnaround time and getting the results back on the PSE test?
I think that realistically, the clock on turnaround time starts at different times depending on who it is that's thinking of it. The doctor that says, yeah, the clock starts when I think of it, or the clock starts when I order it, is different than when we get it. It takes a couple days to do. I think a realistic way of thinking of it is it would be about 10 days. The reality of it is that we will get the test run in the week we get it for the most part, and it takes about 3 days to run. But we have to get it. We've got to get it a session. Sometimes we have questions for the doctors. But I think 10 days is a reasonable expectation.
Well, thank you very much for getting our listeners up to speed on the EpiSwitch PSE test. I was really excited to begin offering the test in my practice already this last month. And we've ordered some already on patients. So I'm definitely excited to be up and running. Any final thoughts today for our listeners?
I really think that there's a role for this test in many different scenarios, but mostly it's in my own personal experience. Recently, I had my PSA went up and I was in the throes of scheduling the MRI and talking about biopsy, and I got my PSE result back and it turned out to be negative. So I think it really helps men relax when their PSE is in that sort of nether range, somewhat more than 3 and somewhat less than high. By high, I mean maybe double digits. And we have seen PSE results with PSAs of 7 or 8 that are negative, and we've seen PSAs of lower than that on the order of 4 that have been positive. So I think this has a role for sorting out that group of men specifically, which is probably the majority of the people that you see in your practice.
Well, thanks again. I'm definitely excited to have access to the test now, as will other urologists and patients. And we'll make sure to get in the show notes the links that you had mentioned and all of the appropriate links that patients can go to get more information on the test and how to go about getting the test and what that involves. Dr. Heaton, thank you again for taking time to come on the Prostate Health Podcast today, really giving our listeners tremendous value, helping empower them along their journeys. Thanks again.
Well, thank you so much. It's been a pleasure.
Thank you again for listening to the Prostate Health Podcast. For those of you wanting to dive in even deeper, make sure to check out the Prostate Health Academy, which offers comprehensive and easy to navigate lessons that I have prepared for you. There's also an active private community forum, and I am there every day providing support, insight, and answering questions. To learn more, just go to www.prostatehealthacademy.com, click on Join Now. Well, that's it for today. We will see you at the next episode.